Pennsylvania, briefly, the governor, and I've been asked several times today, why did the governor decide on chronic care? Why did Governor Rendell decide to implement that the chronic care model was the approach that he should use? And all I can tell you is that he's smart. I have no idea how he came to all of this, but. And they established a structure they had these very ambitious goals for rolling the chronic care model out in a large percentage of Pennsylvania primary care practices. The work was delegated to the Governor's Office of Healthcare Reform, which was guided by a multi-stakeholder commission, which is a sort of a who's who of healthcare in the state, and it has all the usual candidates, all the P's: providers, payers, policymakers, real people, patients, patient advocates, and so on. We worked with the commission to develop a strategic plan, and the strategic plan for implementation was to use the collaborative model, but to do it on a regional basis because of regional variation in Pennsylvania in health plans and medical groups and medical culture and so on. So trying to do something statewide didn't seem to fit. So there are now steering committees in each of 4 regions of the state. The state has been divided for this purpose into regions. And in each region, we are doing collaboratives supplemented by practice coaches. The practice coaches are provided by a Robert Wood Johnson national program called Improving Performance in Practice, which is in multiple states. Pennsylvania happens to be one of them. The collaboratives focus on diabetes and asthma, asthma for the pediatric practices, diabetes for the adult practices, and they're fairly typical collaboratives, and the coaching is on site by trained coaches trained by IPIP. Now, there are a couple of major sort of new features. So far, what I've told you is pretty much what we in the Health Disparities Collaborative have been doing. The big difference is the engagement of the health plans, and the health plans across the state. And it's the vast majority of the state-based health plans. The nationals are a little bit more variable. Have created large financial incentives for practices to participate and to make change. Now, the interesting thing is that the model for change is the patient-centered medical home certification of NCQA, which is creates a little bit of a tension because all of the clinical focus is on chronic care model, chronic care improvement. Patient-centered medical home, it certainly incorporates the chronic care model, but much more. But nonetheless, that seems to be working. So the addition of these major financial incentives. Now, there's one thing I haven't said anywhere today, is that the health plans have insisted that some of the financial incentive be used to assure that the practice has access to nurse care management for high-risk patients, which I think is a very wise thing. The evidence is increasingly strong that effective nurse care management is a powerful tool for improving diabetes and other clinical performance. So that's the state. That's the Pennsylvania program.